You may have heard about schizophrenia. You may also know someone personally who is a schizophrenic, a friend, a colleague, or even a relative. You may even be diagnosed schizophrenic yourself. And that leads us to one question. Do you fully understand schizophrenia? Although there have been comprehensive mental health awareness campaigns almost everywhere, held by health institutions around the world, schizophrenia still has another unheard side. First, we must emphasise that schizophrenia is not madness. People may have thought about it that way for centuries, because it is yet the most stigmatised and misunderstood psychological disease even among psychiatrists themselves. All the confusion and fallacies around this disorder are due to the misconception of it splitting the mind. But schizophrenia is not a split personality disorder, contrary to the common belief. It is rather a split from reality. It may seem that I'm exaggerating. Although schizophrenia is a rare psychological disorder, I mean it affects only 1% of the population, but it can take the form of a severely disabling disorder. What makes it harder, even for doctors, is that they cannot identify a specific reason that causes schizophrenia. Its appearance is rather a result of a combination of genetic and environmental risk factors. And to add more difficulty, schizophrenia doesn't start the same for everyone. Early symptoms can be so easily missed because they may seem like someone in a bad mood, such as irritability or slight personality changes. But as the course of the disease makes more progress, more symptoms start to appear. These symptoms creep slowly into the behaviour of the patient. The symptoms in this condition are divided into positive symptoms and negative symptoms. Many people are familiar with the positive symptoms, such as hallucinations, either auditory or visual. Patients usually hear something that normal people don't hear, or see something that doesn't exist. Another positive symptom is delusions. And believe me, they can be so bizarre that patients may think that someone is trying to kill them, or maybe they are the most well-known athlete in the current century. At some point, patients become incongruent with their reality. These are the well-known symptoms and the ones that are represented more in movies and theatres. Although positive symptoms are the most vivid, they are not necessarily the most important ones. Another set of symptoms are more persistent and pervasive, with much more effect on the quality of a patient's life. They are negative symptoms, and they are the focus of our video today. Positive symptoms represent the appearance of new behaviours, while negative symptoms are more about the absence or reduction of normal behaviours. Negative symptoms can manifest as zero motivation, lack of interest, inexpressive faces, monotone speech, few gestures, and inability to act spontaneously or feel pleasure. In addition, they can appear years before a patient experiences his first acute schizophrenic episode. Psychiatrists have names for these symptoms. Let's start with Alogia, which means poverty of speech, and it is a direct result of the disorganized thinking of the patient. It includes using fewer words, speaking in a vague, repetitive, concrete way, and answering only the asked questions. Some severe cases may suffer from fragmented speech without meaningful content, a condition known as word salad. Another symptom is asociality, when a patient becomes no longer interested in forming or maintaining social relationships with others. One of the most crippling symptoms is anhedonia. Anhedonia is the inability to feel pleasure anymore. You might wonder, is it so bad? Anhedonia is a real struggle for those patients. Imagine that the things that made you content and happy once are no longer enjoyable or fun. And it is not only about enjoyable things, but things may get worse, and a person may even struggle in his relationships with family and friends. Patients usually skip invitations to events, parties, weddings, concerts, or even one-to-one get-together outings because they no longer think there is a point in taking part. The reward system is not functioning very well. Such withdrawal puts patients under more pressure and stress because people can't understand what's wrong. Social relationships usually thrive on positive feedback. For instance, when you go out with your friends, you usually tell them that you had fun and it was a nice day, and let's meet up again soon. But patients with anhedonia don't have these feelings. It's so incapacitating that they cannot enjoy regular things, let alone their loss of libido, and decrease of sexual desire that devastates their romantic relationships. There is also abolition. Normal people usually take steps if they have an annoying job or task they must do. But with abolition, even the simplest of tasks, like getting off of the couch to wash the dishes, can feel like climbing Mount Everest. It is a total lack of interest and motivation to be initiative, which makes everyday life pretty much hard. Patients can't start or finish the task in hand, and believe me, it is not as simple as it may seem. It can reach the extent of not being able to take care of personal hygiene, or worse, losing their jobs. Every day is a real struggle for patients with negative symptoms. Every day is a new battle. It may be a bit complex because negative symptoms are the main reason why schizophrenia patients cannot live independently. And let me explain that to you, in contrast with positive symptoms. Positive symptoms give patients the urge to seek therapy and treatment. I mean, it is scary for patients to see or hear stuff only they can see and hear. And they are effectively treated with antipsychotic drugs. On the other hand, patients with negative symptoms are truly suffering and struggling to keep their jobs, maintain social relationships, or even manage everyday life situations, let alone the social stigma and the other secondary negative symptoms they may develop as a result, such as social anxiety, depression, loss of social drive, and inexpressiveness. Negative symptoms can be challenging because they are traditionally viewed as treatment-resistant symptoms, but recent researches show that they respond to medical and social interventions. Even a modest improvement can make patients' lives better. Always remember that you are not alone in this, and with proper treatment, you can beat schizophrenia and have the best quality of life. So thank you for watching. If you liked our video, please like and subscribe to our channel, and push that bell button so you don't miss our new videos.